Good day. Welcome to my presentation on the changes to Discovery Health's KeyCare option for 2013. My name is Seppi. I'm an independent financial planner from Colosseum Consulting, and at the end of this presentation you'll find some contact detail for me where you can get a hold of me if you have any further questions. Let's have a look at some key observations and strategies that KeyCare has got for next year. First of all, KeyCare still remains an option that provides the richest benefits at the lowest contribution, and this has led to exceptional growth in the KeyCare option within Discovery Health. And for 2013, Discovery would like to extend the access to this option as well as maintain a strong growth. And in doing so, they are going to introduce a lower price point to access cover as well as update the income definition for employer groups. The unfortunate thing about the KeyCare range is the fact that there has been some adverse selection by individual members, and this of course could negatively impact on the sustainability of the scheme. In future, Discovery would address the impact of adverse selection, and they're going to do this to ensure long-term sustainability within the scheme. And in doing so, they unfortunately have to remove the lowest income band on KeyCare Plus, as well as adjust the child contribution rates for incomes below 6,250 Rand a month. Focusing on the lowest income band within KeyCare, it is surprising to see that KeyCare Plus for income earners below 3,900 Rand a month is large enough to actually be a medical aid on their own, with members in excess of 50,000. Some underlying experience that Discovery experienced within KeyCare is much worse than the rest of KeyCare Plus. And on average, the lowest income band on KeyCare has got 147% higher pensioner ratio than the rest of KeyCare. The average age is 3.4 years higher than the rest of KeyCare. There are 23% more chronic medicine users on the lowest income band, and the average claims per member per month is on average 131 Rand more than the rest of the KeyCare Plus members. For 2013, as far as the definition of average monthly earnings is concerned, Discovery is removing variable income sources, and this includes variable pay as well as commission. In future, employer groups only have to look at regular salary, guaranteed allowances, as well as employer benefit contributions. A new option for 2013 is being called KeyCare Access. With KeyCare Access, members will still have access to unlimited GPs in the KeyCare network, as well as dental visits. Emergencies and trauma would still be looked after in private hospitals. Childbirth and postnatal care will be in a private hospital network, and then for elective procedures, these would happen in accredited network facilities, including state hospitals. And this is coming to the market at an entry point of 450 Rand for a principal member. In essence, there will now be three options in the KeyCare range for 2013, and this will include KeyCare Plus, KeyCare Access, the new option for 2013, and then KeyCare Core. The difference is the fact that with KeyCare Access, as far as planned hospital care is concerned, this would happen in contracted state hospitals, and of course with KeyCare Core, there aren't real day-to-day medical care benefits for members. If they require that, they would actually then rather choose to be on KeyCare Plus. Having a look at the KeyCare Access private hospital benefits, as far as childbirth and postnatal care is concerned, members would go to a network of 32 private hospitals, and I will shortly show you a list of the hospitals and how they are spread within South Africa. With regards to emergencies, members on KeyCare Access would have exactly the same benefits as members on KeyCare Plus, and this would also include trauma events. As far as the KeyCare Access private hospital network is concerned, for childbirth and postnatal care, in Gauteng, there's a list of 10 hospitals. KwaZulu-Natal, there are 6. In the Western Cape, there are 5 top private facilities. The Eastern Cape has 4, Limpopo has 3, and the Free State, Northwest, Northern Cape and Mpumalanga each have 1 top private facility for KeyCare Access members to use. The real decision that some of the KeyCare Plus members that were on KeyCare Plus for 2012 would have to make is what to take for 2013. And in particular, it really relates to members earning less than 3,900 Rand per month. If those members would still in future require full private cover, it means that they would be on KeyCare Plus and their contribution would increase from 485 Rand for a principal member to 638 Rand for 2013. If, however, those low-income members are just happy with private hospital cover only, they could elect to be on KeyCare Core for 2013 and the increase would only go up to 511 Rand. If, however, the newly created KeyCare Access appeals to them, they could then still have private day-to-day cover as well as critical private hospital care, and this would then only cost a mere 450 Rand for next year. KeyCare and KeyCare Access, who are these plans for? It's really an affordable way to get private cover out of hospital as well as for emergencies to people that need it. This would include parents-to-be and, of course, employers who want to be sure that their staff have access to GPs, medicines, and dentistry benefits would then elect to put their members and their staff on KeyCare Access. I thank you very much for your time. You're more than welcome to email me at seppi@colosseum.org.za or give me a call on my cell phone if you have any further questions.